Our work is animated by a very simple, but also, in my opinion, profound idea. And that is, because people are connected, their health is connected. All of us have our friends, our relatives, our neighbors, our coworkers, and all those people in turn have similar individuals. And that all together then we develop these vast, elaborate, ornate network structures, these social networks. And that we proceed to live out our lives embedded within these networks. Taking that idea in and understanding it gives us whole new ways to understand humanity. And in addition, understanding this fundamental reality of our humanity, in my judgment, not only advances our understanding of ourselves, but also gives us new opportunities to intervene in the world to make it better. In the past, it hasn't been possible to take advantage of this understanding of human social interactions in order to improve people's health because we haven't actually been able to discern these connections between individuals. So the challenge is, how can we map networks? Can we discern the interactions between people, these invisible ties between people that are so crucial to how we live our lives? And if we map out these ties and discern these ties, can we then pick individuals from within a population, some structurally influential subset of the population, and persuade them to do something desirable with respect to public health? We can get whole villages, in fact, whole populations, to change their behavior for the better. So in this study, with support from the Bill and Melinda Gates Foundation and with our partners at the Inter-American Development Bank and the Ministry of Health in Honduras, what we're doing is we're conducting the largest ever mapping of face-to-face networks in the highlands of Honduras.
So the project's going to involve ultimately about 160 different villages or aldeias, and those villages comprise about 40,000 individuals.
It's a very poor part of the world, coffee-growing region, very hilly. People in this part of the world live on less than $2 a day. It has facing substantial decrements with respect to not only poverty, but also health. And what we're doing is we're mapping these face-to-face networks of these 160 villages, and then we're experimentally, randomly assigning different villages to different targeting algorithms.
A lot of these villages, they're very self-contained. There's not a lot of crossover between the villages, so we'll be able to have little sort of tight, independent laboratories in each one of the villages we're working on in Honduras in order to be able to test out our ideas.
So all the villages are getting the same public health intervention, but we are choosing individuals differently across the villages to evaluate, if we don't have enough money to give it to everyone, to whom should we give these interventions so that if they adopt the intervention, the whole village will adopt the intervention.
We're very excited to be applying these network strategies here in Honduras. We will be conducting the randomized trial in the Copan region, which is on the western part of the country, and where we have seen in the past really high rates of infant mortality and maternal morbidity. Infant mortality is a big problem in Honduras. We know, that there have been very successful interventions that have been done, so we're going to be building upon, known interventions and finding out how to best use those resources.
So our team, we are non-interventionists. That's not our expertise. We're network scientists. So for us, it made the most sense to team up with somebody who had a lot of experience in that area and was also knowledgeable and experienced in Honduras. So the Gates Foundation helped us form a partnership with the Inter-American Development Bank, and they are in charge of implementing the intervention.
So right now, the intervention package will focus on specific things that can affect maternal outcomes and neonatal outcomes. And those things are facility-based births, prenatal care, the involvement of fathers. And the intervention will also focus on the newborn care. The first 28 days of their lives is really important. Keeping a child warm, during the first few few days of their lives, making sure that they're breastfed immediately after birth, making sure that their umbilical cord care is appropriate. And so it's an intervention package that's really covering a lot of these issues. And Honduras has made a huge improvement, but there's still room for us to make an impact. And there's a lot of people in the health field here in Honduras that are very invested in seeing a project like this prosper, because it gives us another way of addressing the issue.
This idea of a targeting algorithm is sort of abstract, but the basic idea is that if you map out these networks and you can only reach a certain fraction of the individuals, who should you pick?
So does network position, in other words, have an effect on how likely it is for a new educational program to be effective?
To be able to find, who the best person would be in a community to communicate certain health messages, and having fewer people be trained or given this information could really help to expand the reach of some of these interventions.
So in this study, we have what is known as a 2x8 factorial design. We're randomly assigning 10 villages to each of 16 different treatments. And the treatments are as follows. The one axis of the treatment varies the fraction of individuals to whom we give the intervention. And in essence, what we're trying to see is artificial tipping points. Can we find what's the minimum number of people that we have to get to adopt an intervention before everyone adopts? For example, maybe targeting 20% of the people gets as much cumulative adoption as targeting 75% of the people. That would be enormously valuable to know this. It would mean in the future we don't have to reach everybody. Instead of reaching 100% of the people in one village, we could reach 20% of the people in 5 villages. The second axis manipulates how those people are chosen. So sometimes they're chosen at random, and sometimes they're chosen by this network trick that's known as the friendship nomination technique. It's a way of identifying more central individuals in the network.
People who are more central in the network, they have more friends, they have more contacts, more people consider them their friend. So those people are more likely to be turned to for advice or just to be spending free time with other people in the community. And so this training intervention that they've been through then has a chance to spread a lot further to the other people around them who've received nothing from the public health intervention.
And there are 2x8 cells, and in each of those cells we have 10 villages, and then we are all the villages are getting the same interventions, all related to maternal and child health, and then we're seeing at the end in which of those cells do we get the maximum number of individuals cumulatively adopting the intervention. So one of the things that's crucial to do in this experiment is to show that these ideas are scalable. If we invent a method that works, but only if you have all the headache and expense of mapping the networks in advance, nobody will use the method. So explicitly in our experiment, in this study, we are evaluating a technique that allows you to identify structurally influential individuals without having to map the whole network. So here's how it works. We just published a paper in The Lancet in 2015 using 32 villages in a different part of Honduras and a different public health interventions. It was a clean water intervention and a vitamin intervention. And in that experiment, we had the 32 villages, and we randomly assigned them to 3 different treatments. In all of the villages, precisely 5% of the people got the intervention. In a third of the villages, 5% were chosen at random. In another third of the villages, the 5% of the people with the most social connections were chosen. This required us to map the whole network. And in the third of the villages, 5% were chosen using the following trick. We picked 5% of the people in the village at random. We asked them to nominate one of their friends, and then we gave the intervention to the friends of the 5%, not the 5% themselves. And we found that trick, it's called the friendship nomination technique, which doesn't require you to map the whole network, was the most effective way of identifying structurally influential individuals. Now, of course, we are mapping the networks as part of this project, but in the future, the technique is implementable without the necessity of having to do that. To do this, to achieve all of this, we've had to solve a large number of problems. First of all, we've had to invent ways to map these face-to-face networks. So we have a software program called Trellis, which can be deployed on tablet computers. It involves taking a photographic census of the entire village and then sending out surveyors into the village and asking the respondents to identify their social connections. And we invented this software in order to solve what we call the Maria Hernandez problem. If you ask respondents in this village who their best friend is, for example, a significant fraction of them will say Maria Hernandez. Well, which Maria Hernandez? How can we be certain who it is? And so with this photographic census and with this software, people can reliably and uniquely and comprehensively identify who their social connections are.
Recent developments in sort of mobile technology, in particular tablets, give us the power to use pictures, and a new program that we've created here at the Yale Institute for Network Science. This program allows us to collect data on a much more massive scale than previous studies have done that required a pencil and piece of paper to map connections out between people.
The way that this is possible is using Trellis, which is a tablet app used for collecting survey data. It has what we call name generators, which are questions about your ties with other people, like who is your very best friend, or who do you consider to be a leader in the village.
And an even greater benefit, it's also way more accurate than any data that has been collected before, because we're using pictures to identify the relationships between respondents. It was never previously possible to get such accurate data so quickly.
One of the tools which we've developed here is we have the ability to map villages where there isn't any internet connectivity. There isn't much in the way of cell phone network. And we actually draw in roads and buildings to allow our interviewers to plan where they're going to go. And we can actually use this to tag the buildings in advance and give them unique identifiers before we even enter the village. We want to release a version to research teams everywhere that they can use for studies conducted in all different environments.
The types of data we are collecting are demographic data, census data, household data. We're asking questions about maternal child health, current practices, community norms.
Still, people are going out into communities and trying to target individuals and thinking that if that individual just changes their mind, they're going to change their behavior. And they don't realize, well, sure, you can tell a woman to go to the facility, but if she gets home and her mother-in-law is saying no, her husband's saying no, we don't do that, that intervention didn't work.
And so we'll see how people's friends and their friends of friends influence their, not only their attitudes, but their perception of community norms.
So this is a directed network graph of people in one of the villages with whom they like to spend their free time. And it's a directed graph because you can see these arrows that this person nominated this person nominated this person.
So one of the first problems we had to solve was to develop software and hardware and techniques that would allow us to reliably and accurately map these social networks. The second thing we had to do is we had to develop different sorts of targeting algorithms, different ideas about how to identify the structurally influential individuals. And we've done that. We have a number of ideas about how to do that. Ways to pick individuals, and that's what we're testing in this study. Taking proven interventions off the shelf, but to have different individuals from within those villages chosen according to these mathematical rules. The third thing we have to do is build a whole infrastructure to deliver these interventions in these demanding circumstances.
This is it's a large operation, from setting up the offices in this region, creating the relationships that allow that to happen. How many trucks, you need per office, how many people, we're able to deploy. For the team that is going to be based in Honduras, we will be hiring about 100 surveyors.
And then they have teams of 5 people, each with a leader. And those teams of 5 individuals go to each rural aldea to really get to know the communities, collect a photographic census.
People in the community already know us, they're already happy to help in every way. Going to these villages is not easy. You have to go through mud, the rain, the really, really hot sun and humid days. And it has been really impressive to see the determination and passion that a lot of our surveyors have for the project.
And there's even one aldea that is more than a 2.5-hour walk from the nearest road that takes you to it. But that's also excellent for the study. The more isolated the networks are, and the more we can begin to examine each social network as a separate unit of analysis.
And then the fourth thing we have to do is follow up and see what happens. So what we're going to do is we're going to come back a year and 2 years later to all of these villages, and we're going to evaluate not just does the person to whom we've given the intervention respond to the intervention, change their health behavior with respect to these maternal and child health outcomes, but also whether all the people around them do. So for example, if we pick 5% of the people in this village, or 10% of the people in this village, and if we pick them according to this algorithm or that algorithm, can the whole village adopt the practice just because we've picked the 10% very shrewdly, very strategically? And finally, in addition to that, we're going to test something which, to my knowledge, hasn't really been tested before, which is how do public health interventions potentially reshape these societies? We're going to remap the social networks at the end of the project and see how does delivery of health interventions change the structure of social interactions in these communities. And part of this project also involves an educational mission. So we're trying to advance an understanding of how network science can be deployed to improve public health. We're engaged in diverse sorts of outreach efforts, publicizing the relevance of an understanding of human social interaction for public health interventions, getting Yale undergraduates and taking them into the field to show them how public health works on the ground, developing new mathematical and scientific tools and publicizing and publishing those tools, interactions with the media and the world in general. So on multiple fronts, we're trying to get people to see that actually taking seriously this contention that because people are connected, their health is connected, gives us new ways to intervene in networks.
Coming here has made me learn more about how much more there is to medicine than just the doctor-patient interaction. It's not just how much the doctor knows, how much education the doctor has had, but rather where the patient comes from, what their life is like, that influences their health.
I grew up here in Honduras, so I've been seeing a lot of these issues over the last 20 years, and knowing that there's something that we can do and study and that we will have real results is really exciting.
One of the reasons I care so deeply about this project, which is part of a broader initiative in my laboratory in the Human Nature Lab, is that around 2009 or so, along with my long-term collaborator, James Fowler, James and I began to ask what we call our so what question. So what can we do with this knowledge? So what if we understand the structure and function of human social networks? What can we do with this knowledge? How can we take advantage of mathematical, biological, sociological, and psychological understanding of human social interactions to make groups of people more cooperative, more innovative, more healthy, more safe, more wealthy? So this is a central focus of my laboratory at the moment.
To the extent that we are changing one person's life, if that spreads from person to person, you're actually changing more than one person's life. So if I know that changing you is on average going to change 2 other people, and then I do a cost-benefit analysis and I think I've only changed you, I'm underestimating the benefit by 2/3. I think I changed 1 person, but I actually changed 3 people. I mean, that gives me goosebumps. This idea that it's possible to use this kind of science to ramp up, to leverage everything that we're trying to do to make the lives of others better.
I do think that this project really does represent a significant step forward for network research, especially in the public health domain.
This idea that one can sort of harness people's interpersonal relationships and an understanding of social networks to implement some sort of positive, long-lasting change is a really exciting concept. So whether that be in the context of human rights issues or public health or education, this is something that I wanted to explore more and am able to explore more in the field down here.
We've really got 3 things coming together where we've got entire villages that we're studying, and we have an intervention, and we can randomly assign that intervention. An RCT, a randomized controlled trial, is pretty much the gold standard for inferring cause and effect relationships within any kind of research. And so once we see things happening in the network, we know it's actually caused by what the interveners did with their educational program.
No study has ever been collected on this sort of with social networks on this scale with this many different units of analysis. We don't know what we're going to be able to provide to science as a whole, but we're all very excited for that opportunity.
So this project requires lots of components. It requires new ideas, new tools, new data, new field operations in a challenging part of the world. We have large numbers of people with diverse expertise at multiple sites around the world, all of whom are partnering to deliver this intervention and test the network targeting algorithms, all with the mission of trying to identify ways to make the health of underserved communities better, and all with the mission of trying to improve maternal and neonatal health and nutrition.